Ciao mondo, hello mon, hola mundo, konnichiwa, ni hao, namaste. We are in Istanbul at the special consensus conference on DPMAS, double plasma molecular adsorption system for liver support. And I'm here with one of the nice members of this consensus team that will present the indications and will try to establish the classic and alternative indication. Can you introduce yourself?
Hi, Professor Ronco. It's a pleasure for me to be with you on this platform. And I'm Dr. Maiwall. I come from India, New Delhi, and I belong to the Institute of Liver and Biliary Sciences, where I am in charge of the liver intensive care unit. And I see a huge volume of patients with liver failure who come to the ICU in the intensive care with multi-organ dysfunction in the context of acute and chronic liver failure, patients with decompensated cirrhosis who have sepsis-related organ dysfunctions, and also liver as a part of systemic organ dysfunction. In our country, we see a lot of tropical infections like dengue and malaria and the leptospirosis. So we see all such patients who have jaundice in the context of which we call as ALF mimics in our ICU. So a huge population of liver failure patients that we see in our intensive care unit.
So what do you expect from this treatment to be achieved in this patient?
So for us, we all will agree, when we are dealing with these very sick population of liver failure, the important challenge to us is to manage the difficult organ dysfunctions, because if you do not have anything to support the failing organs or the extracorporeal liver support systems, these patients will quickly go on to the multi-organ dysfunction. And you need time for them to arrange a liver transplant, and specifically whether we are dealing with a deceased donor or a living donor liver transplant, you need support therapies for them so as to get time for the patient not only to the potential to recovery of the organs, but also to get a timely liver transplant.
And how can DPMAS help?
So DPMAS, I feel it's a very exciting therapy because it has a potential to improve all the important cytokines, which are mostly large molecular weight cytokines, bilirubin, bile acids, albumin-bound toxins, the inflammatory mediators, and all these toxic metabolites will impair the liver regeneration and will also cause multi-organ dysfunction by impairing the microcirculation. So it becomes a very potential therapy in managing these patients.
So one more technique among those we call MOST, multiple organ support therapies. So this is an extracorporeal therapy in which doctors taking care of complicated liver patients hope to find solution to the main problems, which are blood intoxicated by retention molecules, including bilirubin, bile acids, and also many other, including inflammatory mediators. And the component of the two sorbents that are utilized may help to achieve a real blood purification in this patient. So with this, thank you very much for joining today Cappuccino in Istanbul. And thank you very much for being with us. And let's see if the manuscript will come out very quickly. But for sure, at the Vicenza conference on critical care nephrology in June, we will have a presentation about DPMAS. With this, thank you.
Thank you.
And excellent.
Excellent.